Hi John and Barb, my name's Lisa and I'm one of the palliative care nurses, and I'm just coming in here to talk to you about some symptom management today. Palliative care is all about symptom management. We do lots of things with symptoms of pain, nausea and anxiety, and you've been having some problems with pain, and so we're just here to have a bit of a chat to you about that. So usually when a person can still swallow medications, we would give things orally, or we perhaps use some patches to control the symptoms. But if the symptoms are really hard to control, or if the person can't swallow anymore, then we use this little device called a syringe driver. And it's just giving it's a little battery-driven pump, and it's giving a measured amount of medication just over a long period of time, slowly and controlling those symptoms. So we just put a little needle in under the skin. It's sometimes called a butterfly, or an intima is the other word that we use for it. And it just attaches to this tubing and then to a syringe. And then that connects into our pump. When we're going to set up one of these syringe drivers, we'd put two of these intimas in, probably one on each side. And so one of them the pump will be connected to, and then the other one will be used for what we call breakthrough or top-up medication. So when you've got this going, you can still have some episodes of pain, and so then we need to be able to give them some extra doses of medication if that's necessary to relieve that pain. These little intimas can stay in place for up to a week unless they become red or sore or blocked or fall out, and then we would need to replace them. So when we're going to start up one of these, we usually give people this little package, and in this package it's got a DVD and a memory stick so that you can plug those into your computer or your DVD player, and that's just got step by step of how to give the breakthrough doses of the medication, and we'll go through that with you and teach you how to do those. It's nothing to be worried about. It also has got a little chart in here that it's really important when you're giving those extra breakthrough doses of medication that you record when they happen. So the date and the time that you gave them, what the medication was, so if it was the pain relief medication, the dose that you gave, and then whether it worked or not, so that we know whether it helped. And then the next time that we come to fill up the syringe the next day, we can look at how many extra doses that were needed, and then we can add those extra doses into the syringe so that then hopefully you won't need to give as many top-up doses, and that'll just keep John much more comfortable. Some of the things that I guess, they're a pretty straightforward little pump, but sometimes things can happen. And when something does go wrong, it's got this screen here and an alarm will sound, and it'll actually tell you on the screen what's the problem. So the most common thing that would happen would be an occlusion. So that just means that the medication's not getting through because it's blocked somewhere. And it can be most often because the tube's just kinked over. So what you would do if the alarm was going would be come up here and just make sure that the little needle is still in place underneath the skin and it's not red or sore or anything, and that this whole piece of tubing all the way down right back to the pump is not kinked off or twisted or anything there. And then if that all looks okay, then you would press the yes button and it would continue again. Now if it continues to alarm, then there's probably something wrong with the little needle up here, and so that's when we need to do something about it. Now that will depend how confident you're feeling. So if you're feeling pretty confident about things, which you will be because we'll have taught you how, in the other little intima that we've got in the other side, what we can do is draw up a little bit of saline, and you can flush that and make sure that that one's working okay. And then we can just unscrew the tubing from here and switch it over to the one on the other side. Press start and off you go again. And then where it's got the two little points, you'll be able to give the breakthrough doses of medication through here. And then the next morning when you can get in touch with your palliative care nurses, then they can come and put a new one in. Obviously, if it happens while your nurses are still on at work, then get in touch with them first up and then they can come and do it before all that happens. But if that hasn't been able to happen, then you know what to do. The other thing that might happen is that it might say that the battery's flat. Now the nurses will be checking the battery each time when they fill it up, but sometimes the batteries can go flat, and so there's just a little spot on the back here where the new battery fits, and you can just pop that battery out and pop a new one in. If you were to drop this, they're pretty hardy, but if you were drop it, the syringe might dislodge, and in that case you would need to get someone to come and help you. And so ring your palliative care nurses. If they weren't available, well then just continue to give the breakthrough medication through that other intima so that John's comfortable and there's no, we can keep that pain under control. If you're concerned about anything or you're not coping with what's happening or the alarm won't stop, then you know that you can always ring an ambulance and get them to bring John into hospital, and we can sort things out from there. We also have the after hours, the doctor helpline, and you can ring that 1-800 number and they can actually give you some assistance over the phone, and if they can't help you, well then they'll also tell you to ring the ambulance and get the ambulance to come there. So it's pretty easy and it doesn't generally go wrong terribly often, but if an alarm goes off in the middle of the night, you like to know what it's about, so it's all pretty good. So I'm sure we'll be able to get it all sorted out for you.